Hey, welcome to Facts at 5, everyone. I'm Michael Clark here at the LTV studios in Wayne Scott, New York, with the lovely Morgan Vaughan. Say hello, Morgan.
Hello, Morgan.
Hey, the big news, obviously, on the East End these days is all of us being a little discouraged at the news about the vaccination rollout, as is the rest of the country, obviously. The good news is that the supervisors and the local officials have sent a letter, trying to support us and do the right thing. They all got together and sent a letter to Governor Cuomo, just talking about their how they're displeased with the rollout, and in fact they're calling it too slow and too chaotic, which I would have to agree to. I mean, yesterday we tried to get online to do it, and it's saying that we're out 22 weeks, which is a really long time. And they said that the vaccine distribution center on the East End with the new expanded eligibility categories is virtually non-existent, the letter said. East End residents, especially senior citizens, cannot be expected to drive an hour or more to vaccination sites at Jones Beach, Stony Brook, or Brentwood, the lawmakers said. While we have submitted many suggestions for locations in our communities for consideration for the distribution of the vaccine, those suggestions have gone ignored, the letter said. So pretty strong words. And as you know, the site at Jones Beach opened yesterday to the public, and that apparently there was a lot of people there, which of course it's going to be at the beginning of a rollout, but and with the dosages and stuff like that. The point here is, I guess, that there's so much misinformation out there about how this is rolling out, what's going to happen, and it goes back to the very first 8 months ago, 10 months ago, whatever it was, when you and I discussed doing a Facts at 5, because all the information that was coming up about COVID, we wanted to make sure to put forward the right information, with sources and all that. And yet here we are, and then we're still doing it. And now we're on to the next phase of that in terms of dealing with the vaccination process. But there's still a lot of stuff floating around out there.
Well, and I think one of the things, in my opinion, this has always had to be something that was on the federal level. The feds have to be able to help, and by letting the towns and the states take care of this, that is just not how it's going to go. And then also by sort of some states get this and some states get that, it's not working that way. And I really do believe that our town government, and you have an interview with Peter that we did yesterday, is working really hard to try to figure this out. They've gotten a testing site, and as we said last week, wouldn't it be great if it was a vaccine site? They are really trying to work on it, but the vaccines aren't there.
Right.
They can't get them.
Right.
And then, the idea, and this is such a special place for many reasons, but one of the things is that people who don't live here don't understand is that driving to Jones Beach when you're 65 to 70 years old, first of all, you can't take a bus of seniors because then you're exposing everybody to the virus.
Right.
Right? Yeah. So then you have, so now I'm 75 and I have to figure out how to get to Jones Beach, to and from Jones Beach. And I don't want to drive at night because I can't see very well at night. And that turns into a really big problem. And Peter's point that he'll say later is well taken. Any way you can get there, but the logistics are just we're not ready for it. And it's really too bad.
Yeah, and what?
But I don't think it's for lack of people trying.
No, everybody's trying real hard, but I guess in being that we're so well into this pandemic, everybody expects things to be right. But a good example is if you go to the New York State website yesterday, you go to the website, the New York State today says, we have these testing sites, vaccination sites available coming up, blah, blah, blah. Contact your doctor or your local pharmacy to do that. these people locally here, like CBS, everything, getting inundated with phone calls that they can't even, they don't have the personnel to even manage the phone calls because the New York State site is telling them to call the local pharmacy, and they don't have a clue as to what's going on because they don't have any of they don't have the vaccine. They don't have it. It's not there. So it's,
It would be funny if it
this will
weren't
get
so
better.
awful.
Yeah, it'll
But
get better, but
one of the things that we knew, and I've heard a lot of people say, and I'll tell you a little secret here. My whole married family is very staunch Republicans. I'm independent. I'm not always a Democrat, but I have a lot of Republicans in my family. And so they want to give Trump a little bit of credit. And so I heard, and that's fine. That he really should get credit for Operation Warp Speed. And the truth is that getting the vaccines is fantastic. But we heard this last year.
right.
The issue is not really, because they were almost there with the vaccines anyway, because it's a coronavirus that they were already working on in that family of coronaviruses. The real issue is always going to be distribution.
Right.
Because of the stipulation, because you have to keep it at, -10 degrees or at absolute 0 or whatever the Pfizer one is. We don't even have trucks who could do it. There's not even hospitals on the East End who can handle that. And
Right.
that was one of the things that I think is also interesting, is that when you start complaining about how we're not getting this, we're not getting that, we can only do one of the vaccines right now. We can't even say, oh, we can do both vaccines. We can only have the Moderna vaccine because it has to be kept at its more reasonable cold temperature.
Right. So, it's interesting though that, and I talked to Peter about this in the interview that follows as well, that, as soon as things aren't going right, we'll just blame it on the local government.
Right.
And these, these poor guys, regardless of what side of the aisle you sit on, Republican, Democrat, whatever, they're sitting there going, our hands are tied. There's nothing we can do at this point. So it was good to see that they wrote this letter anyway and let, Governor Cuomo know that, people are just not happy. Things are in disarray, and, it will get better.
Well, I was joking with you before, like, I want the vaccine. I'm ready to, get it as soon as I can. Of course, I want everyone else to get it first, who, is vulnerable populations, but I can't even get Stop and Shop to deliver at my house right now. Like, honestly, what is that? What?
Right. I don't need vaccine. I don't have any food.
Can I get some milk? I mean, like, it's not, we live in, I don't know. I mean, I've lived all over the country at this point, and this is the craziest place in terms of logistics.
Yeah.
It is. We are out there. We are stuck on a little tiny island where people can only go and.
Yeah, it's one direction in. That's it. It's a one-way street. Yeah.
And so right now, the idea that I'm going to get a vaccine when I can't even, like I said, get cookies and milk is.
Well, the good news is that there's also Johnson & Johnson has just about finalized a new vaccine that is very effective and is a one-shot deal. And if they're able to roll that out, via they got to go through the FDA obviously first, but if they're able to roll that out as well in terms, and plus what we have already, that's a game changer. That's going to speed things up incredibly, just the fact that you don't have to go twice. So that's going to be a good thing. So, we'll keep our fingers crossed about that.
And remember, I don't know if you've heard or even think about it, because I don't that much, but we do have a new president being sworn in next Wednesday.
Really?
Has come up with a plan that he published last night that is one of the hugest things about the plan is this vaccine rollout. Is he has a plan or an idea, a goal, let's say, to get 100 million in 100 days.
Yep, 1 million a day. Yeah.
That is and you know what? That if you fail to plan, you plan to fail. Maybe it won't happen, but it's better than what we got going on right now.
Yep.
Which is a whole lot of nothing.
Yeah, you're not kidding.
And not for people on our end, the lack of trying.
That's for sure. And the good news also is that the total hospitalizations yesterday fell to 8,823. Again, just a number. And of the 212,000 tests that were reported yesterday, 13,000 or 6% were positive. There were 1,500 patients in ICU yesterday. This is from New York State.
Right.
This is from Governor Cuomo, which was people in ICU was up for about 35 from the previous day. And sadly, we lost about 202 people, New Yorkers, yesterday to the virus. So, we can't lose sight of that fact. People are
Nope.
dying. Wear your masks, follow the protocols. And, again, we had the new vaccination site, drive-up site at Jones Beach. And
How far is Jones Beach, though? I mean, how long does it take you to get there? I haven't been there forever.
It really depends on the time of day and time of year from out here, but it's probably an hour and a half, 2 hours, right? Yeah.
Okay.
But the line was apparently right down, Meadowbrook Parkway. It was
Right.
a long ways away. So
Yeah, one thing I also wanted to point out, just so that people are aware, the reason we're wearing all these masks while we're doing all this stuff is so you don't end up in the hospital for other things too. Because the hospital capacity is sort of popped back up to 20%, but we were a little bit below that last week. And that is a concern out here. That is a big concern. There is one hospital for us on the South Fork of the East End. And we need to keep, you don't want to be in there.
well, not for nothing. I've not been healthier in terms of colds and stuff like that since I'm wearing a mask.
Right?
I may not ever give it up. I don't know.
I was thinking that. I was like,
I was like, I don't have a cold.
I don't have and now we've said it though, it's over.
Yeah, right. Yeah. So what else is going on? We only got about 2 minutes here, Morgan.
One thing I really want to suggest, and I'll put a link, is this article that we were talking about from the Atlantic about one of the original vaccine rollouts, which it's such an interesting article, but it really, I think it gives about one of these original vaccine rollouts about how difficult it is, because they inoculated 32 orphans with the cow bovine pox, which is similar to smallpox. And then they sent them over to the Americas so that they could pull out the stuff and inoculate people with them.
Wow.
It's what's interesting about it is it's an example of how distribution of the vaccine is completely different from discovering, hey, this works. We can use bovine, smallpox or bovine pox to inoculate small people, people against smallpox, but then you have to get it over to the New World. And so you do anyway.
But wait, that's terrible. Give me an orphan. Give me an orphan to put these in.
Oh, well, it's the night. I mean, there were different ways.
Oh my God.
But anyway, then the orphans got to go live in the New World.
Okay, there you go.
But anyway, of course, we're not going to be inoculating orphans. And just if there's any QAnon people out there, that's not happening either. You got to be so careful what you say. Someone's going to be like, she said 13. Ooh.
Yeah. Wow.
We don't have any of those crazy people around.
Yeah.
Anyway, and also what we were so I'll put that link up. People should read it. It's really cool, really interesting, because we also forget that before this century, people were scared to death of getting these viruses.
Right.
My parents told me about waiting when the polio vaccine came along. It was like the Messiah had returned. I mean,
yeah.
People were scared to death of getting polio.
I have memories of waiting in a line, like in a really long line in a parking lot. It was given on a sugar cube, I think.
Yeah.
Polio vaccine.
Maybe with you, I got the thing I still have the scar from. You can tell how old someone is.
Oh, really?
Yeah. But that is, you don't think about it because we're so used to it now. And now you have people who are like, it's natural. No, it's not. It's not natural. Mother Nature's trying to kill you all the time. And so we're so blessed to have had all these vaccines, and we'll just continue to have them. There's my soapbox moment.
Now, hopefully we'll have a good weekend. We'll have a better week next week in terms of vaccinations and all that kind of stuff. Ladies and gentlemen, please stay tuned and for an interview with Town Supervisor Peter Van Scoyac. Morgan, thank you very much. Have yourself a good weekend.
Thank you, you
And
too. Oh yeah, happy Martin
good
Luther
luck
King
with-
Jr. Dr. Martin Luther King Jr. Day, Monday.
Monday, today's his actual birthday.
Oh, really?
Yeah,
Happy
it is.
birthday, Dr. King.
So, okay, everybody enjoy, and we'll see you soon.